One of them that came in a wheelchair, and he was barely able to even stand up to get harnessed onto the table. We had to have a lot of effort and a lot of extra steps to make that possible. And then by the end of his treatment, he's full on standing up on his own. He's taking several steps on his own. So he's so much more independent now with just being able to move like that. That was impressive to me, actually seeing someone be able to stand and walk, whereas they weren't able to before.
Hello, everybody. This is Dr. Troy on Everything Disc. I'm excited to have you with us today on our show, From Pain to Play. That's really our whole motto here at Everything Disc, is taking people that are in pain and getting them back to playing and doing what they like to do, whether it's golfing or swimming or playing with their grandkids or riding a bike or painting or reading books, whatever they're into for their play. That's what we want to get them back to. So I'm excited that I have a special guest with me today. She took some time out of her busy schedule to be with us here today. So I'm super excited to have Nicole from the Vancouver Disc Center on our show today. So Nicole, I know you like to paint. You like to do those kind of things. You're into music, at least your husband is. But I just
Yes.
want to welcome you to the show today. And thanks for taking time.
Thank you. Yeah, no problem.
So just a little bit about Nicole. She's been working in the Vancouver Disc Center with us for a couple years now.
Mhm.
And we just had our certification team come through and just retune up and recalibrate what we do with disc. So Nicole, can you talk a little bit about what spinal decompression actually does from your perspective? I know you're the one that puts them on the table. You greet the patients. You take their charts, so you know what pain levels they have, what functional
Mhm.
restrictions they have. Can you just tell us what does spinal decompression actually do in your mind, in your perspective from a technician standpoint?
Honestly, it gives the patient the ability to completely relax. I've noticed with other traction methods, there's always going to be some kind of traction or muscle movement. With this, half the time we have people falling asleep on the table.
Hmm.
So it allows your muscles to completely relax while you're going through the decompression motions. And then that's literally what it does, is it carefully pulls and decompresses the spine and the discs, allowing more fluid back into the disc. We're essentially trying to plump it back up like a jelly donut.
Hmm.
Putting the jelly back in. So because they're able to completely relax on the table, I think it allows that to happen more efficiently.
Yeah. And when you say the jelly donut, for our listeners, a lot of people are like,
Mhm.
what is this decompression stuff? And I always say that, if you take a donut and you squish it, it's got jelly in it. That's what happens to the disc. It can start to bulge out. And so what you're saying with what decompression does, it actually helps to pull that jelly back into the disc, take the
Yep.
pressure off the nerve, relieve pain, relieve inflammation.
Yep.
So, what types of cases in your experience have you seen helped with spinal decompression in the clinic?
There's been a ton of them, whether it be just a recent injury or a car accident that's happened. So it was something that was really fresh, to people that have had this kind of pain for years. I did notice that with people that have had it going on for years and are just now getting around to the decompression, it does take a little bit more time.
Mhm.
But as long as they stick to our plan and do their homework, that's a huge one, where they brace, ice their pain, exercise, stretches, everything we tell them to do at home. It really makes a huge difference for them as well. The only time I've seen a couple people that weren't exactly happy with their results, they still got results. They just weren't happy with as far as their results went. It was the people that didn't do their homework.
Yeah,
Yep.
and
So
that's the key.
it really is. And I honestly, I'm a patient too. I had herniated my disc in 2019. I was 30 years old at the time, and they wanted me to go do surgery. As soon as I got the MRI done, they actually had me in the office, I think within 24 hours, which was amazing to me because most appointments are 1 to 2 months out nowadays. So I was worried because they said, get in. And they said it was herniated so much that he thought I was going to be coming in barely able to walk and in tears, and then he'd be scheduling me for surgery. And I was like, well, apparently my pain tolerance is a little higher because I am functioning, difficult, but doing it. And I just wanted to
Mhm.
avoid surgery as much as possible, especially at 30. So I did the rehab and as much as I could, but I was constantly, quote unquote, throwing my back out.
Mhm. Yep.
There was always a little bit of pain, something going on, and then there was those weeks where something would happen and I was just down for the count. And so it wasn't until I actually started working here at Disc Centers And I got the full workup of the x-rays and my 18 to 24 treatments that I don't have those flare-ups really much anymore. There's occasional when I do something not smart and I move a certain way I'm not supposed to, or lift something too heavy, or have a long weekend, that I can feel a little bit of a flare up happen. But then I go through my routine of what I'm supposed to do here with treatments and stretching, and it was a much quicker recovery for those flare ups.
Yeah.
A couple
So
of days.
you're managing your episodes better now.
Exactly. The episodes are very far in between, whereas it used to be like monthly, if not every other week, something would happen.
Wow. Yeah.
So
Yeah.
yeah.
Yeah. And you've seen that with patients from all the time. If they don't do what you tell them to do, they flare back up and then they think things
Yep.
don't work and
Yep.
it
Or they
doesn't work
start
out so good.
feeling or they start feeling really great. So they immediately go back to what they were doing before so fast that then they flare up because they're going back to everything like regular.
Yeah.
So
Well,
yeah,
they didn't give it time to heal, you know?
exactly.
In the office, you see people with like low back pain, leg pain, weakness, neck
All of
pain cases.
all of the above.
What are a couple that stand out in your mind? Maybe a couple cases that really, wow, I didn't think this person was going to get better, or they didn't think they're going to get better, and they responded really well.
Honestly, the two that stick out most in my mind was one of them that came in a wheelchair, and he was barely able to even stand up to get harnessed onto the table. We had to have a lot of effort and a lot of extra steps to make that possible. And then by the end of his treatment, he's full on standing up on his own. He's taking several steps on his own. So though he still uses his wheelchair, he's so much more independent now with just being able to move like that. So that was impressive to me, actually seeing someone be able to stand and walk, whereas they weren't able to before.
Yeah, yeah. And was he told that he needed surgery, or do you recall?
I believe he was told he needed surgery. I know in the past he had also had surgery in other areas, I believe his neck. So he just didn't want to go back and go through that again.
Yeah, yeah.
And we
And
still see him and his wife.
Yeah, I know exactly who you're talking about, and yeah,
Hmm.
that's pretty amazing story when you
Yeah.
see people that they get their function back and they're able to do things that they couldn't do before, and
Hmm.
it's very challenging for people. What was the other case you were going to mention?
So the other case, I think it was more of a recent injury that had happened, but he said that he had it happen quite often, his flare ups, and he was just tired of getting this injury like this from, I believe, his home repairs he was doing at the
Hmm.
time. So he
Hmm.
had been down for a few weeks and he came in just hobbling with horrible posture, barely able to walk from the chair to the treatment room. And it was after, I believe, the second treatment. The first treatment, he said he did feel a little lighter. He felt a little bit of relief. And by the second treatment, he came back for the third treatment and said, you know what, I don't know what happened, but after the second treatment, like I've straightened up. I can walk better. He's like, obviously, there's still some pain there, but I see a clear and obvious difference after appointment two.
Yeah,
So
yeah.
that was really awesome.
That's what I was gonna ask you. How long does it usually take? I mean, everybody's different, but people always ask me this too. How long did it take for somebody to feel better in your experience?
Typically, somewhere between 4 and 6 weeks, they're going to be feeling better. I get
Hmm.
a lot of people that within the first week or 2 are feeling a little bit of a change, but then, like you said, everybody's different. So I have had a couple of cases too where it's almost that full 6-week period, and they just have this aha moment where so much has changed for them. But they were starting to lose hope because, we're pushing week 4 or 5, and they barely saw a difference, and then just it happened. They
Yeah.
had that moment. So yeah, it's a wide range. It just always impresses me when we get those people that within that first week are like, you know what? I'm starting to not focus on the pain as much. And I think that's a really hard case because pain does take over your mind and your focus so
Hmm.
much
Hmm.
that they may be focusing so much on just the pain that they don't realize how much they're actually functioning better in the meantime. Recently just had somebody this last week actually that she kept bringing up the pain over and over and over again. And I asked her specifics on what she was doing that may be better. And she's like, you know what? Honestly, now that I think about it, I was able to put my shoes on and tie them the other day. And there was no problem there. She's like, it used to be I was hating to have to put my shoes on because every
Yeah.
time I would bend forward to do that, it was just instant pain. I'd lock up and I could feel it for an hour afterwards. And she's like, this time I put my shoes on just fine. And I don't think I had any issue after that. So I have to remind her, like, I know it's really easy to focus on the pain, but if you focus on what you're doing, that's getting a little easier for you. You're going to start to realize things are improving.
Yeah. Because if they don't do anything, I mean, if it's a disc issue, typically it's a chronic degenerative condition that's going to get worse unless you have intervention. And
Hmm.
so many people put their hat on, I'm going to have surgery and I'm going to be fixed. And it's like, that's really not a fix. That's just one way to try to treat your pain. And I always tell
Yeah.
patients, I said, if we can get you through the pain, decompression is very, very effective. You're not going to have scarring. You're not going to have side effects.
Hmm.
Even if you go through a treatment protocol, which is very rare, and you don't get results, you can always have surgery. But I remember I was interviewing Dr. Thane a while back, and he said, even though somebody may not get the results they want, if we get the disc healthier and the spine stronger, and then they go for a surgery, they're going to even have a better outcomes.
Yep.
Not that I'm promoting that, but I'm always saying, hey, let's decompress first before we try these other things. So people come in, obviously, they're in pain. And one of the things I always, people they're always scared. They're in fear. They think, well, this is going to hurt. What's your experience with people that might say, gosh, is this going to hurt? And they're terrified. And then they get treated. And how do they respond? How do they react after you treat them?
Just kind of like oh wow, that was so easy. There is an occasion where when they're really, really flared up, where they might feel a little bit of that extra achy after the treatment. Like we often say, it's like we're having a really good workout for the first time in a long time. You get that ache
Hmm.
afterwards.
Hmm.
But for the most part, you're just laying there and relaxing. We've got some music playing for you. I've got blankets. I've got a red therapy glasses that help reduce our cortisol levels. So literally, I'm just telling them, take a nap. Don't
Yeah.
think happy thoughts.
Yeah. Yeah. Most people I've noticed fall asleep. We get some
Mhm.
snoring in there.
Yep,
Yeah. Which is,
we do.
which is kind of fun to see.
Yep, I tell
So,
them I
so
like it.
Yeah, and so when you see somebody like come in, typically how long are they on the table? What's that vibe like in the office? What's that feel like when they come in?
It's so they're typically on the table about 20 minutes. The actual harnessing process and getting it going might take about 5 minutes or so,
Hmm.
depending on
Hmm.
if it's their very first treatment. It might take a little bit longer because I like to walk them through all of the steps that I'm doing so they're aware of this whole process. Especially the harnessing process because we do have the lower harness and an upper harness. So I like to joke around that you're gonna look and feel like you're going skydiving.
Yeah.
Um, you're doing quite the opposite. You're just gonna lay there. So the vibe in the beginning, they are a little stressed. Obviously, if they're in pain, they're probably a little angry at the way that they're feeling, a little nervous about
Yeah.
the process because the machines can be intimidating looking. But if I just find that if I walk through every little step with them, it tends to ease the nerves. And I've gotten a few compliments from a few people now that they really appreciated me telling them every little detail as we go.
Yeah. Yeah. I mean, it can be fearful, especially if somebody's told that, they need to have a fusion or a
Mhm.
discectomy or injections. And then, you take them and put them on this piece of equipment that looks enormous, but it's
Yeah.
super gentle. It's
Yep.
controlled. It's computerized. You can be very specific on which level you want to treat.
Eventually,
And
we get to a point where, a lot of them are sad that the 20 minutes is up. I get a few of them that are like, "5 more minutes, mom."
Yeah, exactly. I like that nap. I still
Yep.
remember a patient that was in chronic pain for about 9 months. She wasn't sleeping, and she got on the table first time. And I went up to check on her, and I woke her up, and I said, "She's like, oh, you woke me up," and I'm like, "Is that normal for you to fall asleep?" She's like, "No, I haven't slept in 9 months."
Yeah.
And first treatment, she fell asleep. So it was pretty
Yeah.
amazing.
Yeah, no, I have a few of them like that that are just they're telling me that even the night before, they slept terrible, and then they get on the treatment table, and within 2, 3 minutes of me walking away, they're snoring.
Yeah,
So, yeah.
it's amazing that it just allows the body to relax because,
Mhm.
as you know, discs are the most painful structure in the spine, and if that thing's lit up, it's just gonna wreak havoc on your peace on the inside.
Yep.
What, in addition to spinal decompression, I know we've talked about some nutritional things,
Mhm.
because we're all about getting the disc as healthy as we can. What are some supplements, that you incorporate into spinal
Yeah.
decompression?
So we have Discat Plus Enhanced. That is going to be the best friend to decompression. It helps bring 9 times more of the fluid back into the disc with the decompression treatments. Also, really anti-inflammatory. Helps with a lot of disc repair
Mhm,
specifically.
mhm.
I have my husband on that actually. I believe there's like 4 or 5 different supplements of ours that I'm putting in the daily container for my husband, and he looks at it and he's just like looking at all of them like, I don't know what half of these are. You could be poisoning me and I wouldn't know it. I was like, no, this is quite the opposite. I'm trying to preserve you with these.
Yeah, yeah, yeah,
But,
yeah.
I think I actually have here, this is the Discat Plus.
Okay. Yep.
So that we give to all of our patients unless they have an allergy to shellfish.
Shellfish. Shellfish.
Yes.
Yeah.
They get a lot of nutrients from the green-lipped mussel. So since
Hmm.
that's in there, we have to pay attention to whether they're allergic to shellfish or not. Another one is the Disc and Joint Pain Relief Complex. Let's see. That's this one. So that one is our major anti-inflammatory supplements that's got a lot of turmeric in there. And I had actually been reading that a past formula only had about 100 milligrams in there, but they found that the turmeric is so beneficial in so many different ways. And done more tests on like how much our body can tolerate, etc. That this enhanced formula has 800 milligrams in there now.
Yeah. Yeah.
So they really upped that. But that one's great also for regeneration and pain relief. I believe there's, gosh, what is it? Willow extract in
Hmm.
there,
Hmm.
white willow bark. Yeah. So
Yeah.
that one helps with chronic low back pain really well. So
Yeah.
that's another one we do.
Yeah, and I've seen patients that I came across that many years ago, and I'm like, just take this stuff. And the people that take it, they notice the change. I notice if I don't take mine regularly, I feel things I don't want to feel. So it's been a great product, and I think it really complements what we do as a disc center. So if you have patients that don't get better, do you see that every once in a while, or is that like a rarity?
It's a rarity. And like I said, the couple people, I mean, I can count on one hand, if just a couple fingers over the last couple of years, the people that have not gotten better. But honestly, our records indicate that their functioning had improved. They were just not necessarily happy with their results. They thought we were going to completely cure them, make them
Right.
feel like
Make
they're
them make
20
them 12
again.
again. Yeah.
Yeah,
Yeah. Yeah.
exactly. And these are the same people, like I said, that aren't doing their homework. They're, not doing what they're supposed to on the daily at home. The only other cases I can think of are ones that ended up with major complications from a previous surgery or an
Hmm.
injection they had before they came to us. There
Yeah.
was a couple cases of major infection that happened
Yeah.
in their spine from those things.
Well, that
So they
one
had to
guy who
stop
had the,
treatment.
the infection, he stopped, got the infection cleared up, came back, and did really well.
That's true. Yeah. Yeah.
Yeah.
He did amazing.
So, so he had a
Yeah.
complication from surgery that decompression wasn't clearing up. So he went and got that treated, came back, and we
Came
corrected
back,
him because
finished it.
the surgery made him worse.
Yeah.
So I remember that case. So how do you like? I know you said you get decompression. How do you like the treatments? Because I know patients always go, "Do you get the treatments?" So
Yeah.
tell us a little bit about your treatments and what you've experienced.
So now I'm on my maintenance plan. So I'm just doing once a month. Unless, like I said, unless I've done something
Hmm.
stupid recently and flared myself up, then I might hop back on the table, once a week for a couple of weeks. But I love it. Same state for the same reason everybody else does. It's nice to just lay there and relax. You can feel the relief of being decompressed and giving everything a break in there. To me, it's just my busy schedule. So it's finding the time to actually get myself on there and being proactive enough to set aside that priority, get on the
Yep.
table, decompress. Yeah. So I've enjoyed the treatment completely.
Good.
Yeah.
Well, that's good. And then one of the other things we do in the office, we do light therapy. Can you talk a little bit about that and
Yeah.
what people say about that?
So it's infrared healing laser. A lot of people are just, especially because it's a short amount of time between 30 seconds and 1 minute. Ours are strong enough. That's all that's needed. But they get that going and they're just like, I just don't see how light is supposed to help me. But our lasers use a combination of infrared and LED. They found that the wavelengths of both those lights working together actually extend the wavelength down further into the muscle. And these wavelengths of light are actually going to help reduce inflammation, increase circulation,
Mhm.
speeds up our cells so that healing is faster.
Yeah.
So we use this on directly on the areas that are being treated, but also I get patients that'll come in and they've recently taken a fall or something like that. They might have some bruising. We'll use the light on the bruising or anything like that too to help heal that up faster. So over time, most of our patients really do enjoy that laser treatment. We've had
Yeah.
a few that have purchased them.
Yeah. Oh, we sell those too.
Yeah.
It's funny you said people go, I don't know how light can really help me. But
Hmm.
if you ask a plant, if a plant doesn't get sunlight, it's going to
Yep.
shrivel up and die. So light
Yeah.
therapy is very beneficial. And
Light
there,
is
I was just
huge.
light's huge. I was just at a conference and they were talking about mitochondrial health. And light therapy actually stimulates the mitochondria in the cell, which is basically it's a little battery pack inside the cell that produces energy inside of it. So
Hmm.
we're stimulating health on a cellular level with light therapy.
Yeah.
And I know one of the other supplements that you guys use with patients is Wuji Corella. Do you want to talk about that for a minute?
So the chlorella is a major superfood. I always feel silly saying it, but I was like, what doesn't it help? But
Yeah.
honestly, it's got a little bit of everything you need in it. Our main goal with it is detoxifying. The more toxins we have in our body, which we get from literally everything now, especially our food, the more inflammation levels we have. So this is going to help detoxify the body. Also helps with your gut health and digestion.
Mm-hmm.
We see a lot of people, especially with low back pain and nerve damage in there, that they have issues with the go. So this helps with the go.
Yeah.
Yeah, the go. It also helps with energy production. Like I said, just very nutritious. Inflammation levels as well. Yeah.
Yeah. Well, good. Yeah. Sounds, I mean, that's why I wanted to get you on the show and just get your perspective from, a technician, somebody who's seeing patients in and out every day. It's one thing to have the doctor talking about it, but it's the other thing to have the person that's putting them on the table, talking to them, just holding their hand all the way through this process. Cause it kind of humanizes it. And plus you like art and all that stuff. And you always have these fun earrings and you got a cool
Yeah.
hat today. So so I think we got a good vibe going in the office. And
hmm
is there anything else you want to tell our listeners today before we sign off here?
Gosh, just to kind of reiterate that before you get cut, give it a try because I think, like you said in the past, once you get there, there's only one cut. There's no undoing it. So
Yeah,
why not give this non-invasive treatment that has a ton of studies of success a try before you go in and do something dramatic like that that doesn't necessarily have the best statistics of success.
right, right. And you've
So,
seen this thing work time and time again.
oh yeah, over and
Yeah,
over.
I mean, that's what I tell patients. I'm like, I know this will help you. Just get on the table, do it.
Yeah. Yeah, we get letters. We still get letters from a lot of our patients, and I've gotten just the biggest hugs when people finish their treatment. Even though I'm still going to see them once a month for their maintenance plan, I'm used to seeing them 3 times a week for the extension of their normal treatment. And so once they're
Yeah,
done with that, they're like, "Bye, I'm not going to see you 3 times a week now." So
yeah.
yeah,
And lastly, I was going to ask you, do you see people get better? Will they continue to get better over
yeah.
time?
Yeah,
Is that what you've seen?
I think the more recent studies show that even after a full year, there was still ongoing improvement because now that they've gone through the initial treatment of giving their disc space and the nerve space to breathe,
Mm-hmm.
now it's just
Mm-hmm.
going to take time for that nerve to fully heal. So
Right.
the longer they go, even after the initial treatments, the higher that improvement's going to continue going.
Yeah. Yeah, just it takes time for the nerves to heal, so
Yep,
really good, really
patience.
good, really good, really good information for our people today, Nicole, so I think that was great, so, I appreciate you taking the time out of your busy schedule from
Yes,
seeing patients to,
I'll
be
get
with
back
us
to it.
today, so okay, I'll let you get back to it, and, I'll see you in the clinic soon, okay? Thanks again for
All
your
right,
time, appreciate it.
no problem.
Okay, thanks, Nicole.